You may have noticed this during the Olympics, athletes competing with a special tape placed on portions of their bodies. So what is it and why was it used? Here's 13 ABC's Allie Clifton.
That's a javelin thrower that has issues with her tricep and her deltoid and infraspinatus, looks like. So this is Carrie Walsh. And you could actually see here, she's got the tape. She had actually had rotator cuff surgery.
The 2012 London Olympic Games showcased athletes competing at the top of their sport. But why were so many of them wearing what looks to be colorful strips of tape?
They're wearing this thing called Kinesio Tape. And basically Kinesio Tape is something that you can put on for a couple of different reasons. You can put it on to support a joint. You can put it on to make the muscles work a little bit better, a little more efficiently, or you can do it actually to increase blood flow.
Dr. Bryan is a doctor of chiropractic and is a true believer in Kinesio Tape. However, he says it's complemented with a technique called the Graston technique.
Basically, Graston technique is a way of getting in and breaking up some of the myofascial adhesions or scar tissue that develops. Kinesio Tape does a very good job at taking away the pain when I'm not around to help somebody, but the Graston technique is what actually, as far as in my opinion, is that that's what really gets people better.
These two techniques have become so successful that they are no longer just beneficial to elite athletes.
Whether or not it's elite level athletes like somebody in the Olympics or whether or not it's a weekend warrior, you can use Kinesio Tape and Graston technique on both. But they're actually techniques that you can use on regular patients too.
Jennifer Miller, who is a local physical therapist, shares other ways as to just how beneficial these techniques really are.
Because not everybody that uses it is actually hurt. Sometimes it's something they use because they think that it feels good. But from a therapeutic standpoint, it's usually something the same way that you take like an ibuprofen to kind of get you over the hump so you could do your rehabilitation and actually get better. It's just something to kind of bridge that gap.
In Toledo, Allie Clifton, 13 ABC, Action News.
All right, so with this technique, would that Kinesio Tape be beneficial for you? Experts say really need to talk to your doctor first, but it does provide some hope, though. If you got some aches and pains, maybe it'll help you out. All right?
That's right. Well, next at 5:30.